Hello, everybody, and thank you for taking time to be a part of this wonderful platform today, which is the International Summit on Women's Health and Rights. It is a wonderful platform created with the collaboration of Mumbai Gynaecological Society, FOGSI, and supported by FIGO. And I thank all the organizations, office bearers of all the organizations, and to Dr. Rishikesh Pai to have invited me and for the very kind opportunity to be a part of very elite faculty here. So I have no disclosures, and the topic itself is very interesting, close to my heart. I think you're all going to look at this, to witness this presentation after Dr. Pai's artificial intelligence based talk. And I think that makes it perfectly placed because I'm also going to talk about novel therapeutics and particularly about what is the new work happening in endometriosis. And obviously, I'm going to talk about the newer modalities, and genomics and AI make a big part of that. So I will be sharing the exact tools specific to endometriosis that are being created, used worldwide, and I'll use this platform to share those, so you can use those open source platforms to collate your data and be a part of this global movement. So, very important part of the presentation is that I cannot help but start my first sentence to put all the focus on one point, which is the central problem of the whole. The elephant in the room is that there's a big diagnostic delay. Even in UK, there's an 8-year diagnostic delay still in this day and age. After the patient says and tell the symptoms, we actually take 8 years before we actually label the diagnosis. And this is appalling. And this is the reason mainly why this is happening is because we are just pleased to call it enigmatic, and we are not getting any further on the understanding. It is only in the last 2 decades that 70%, at least 60 to 70% of all published data on endometriosis have been ever published. So to keep it simple, how interesting it is to realize that most of the evidence-based learning that has come to us has only come to us in the last 2 decades. And many of the papers are still not very powerful though, because the outcome parameters are not set in a way that we wish. For example, when we look at the studies submitted for a topic of a combination of endometriosis and artificial reproductive technologies, meaning when fertility treatments are offered to these patients. So for example, if we look at the paper submissions, most of the papers submitted do not have live birth rate as the one of the outcome parameters. So if we do a powerful study, then only we can get to the bottom of the problem. So for example, if we have correct methodology and the correct outcome parameters, then we would not have to call this disease enigmatic when the next generation is grown up. So in the editorial of the RBM Online written by one of my colleagues, he has very appropriately addressed that there is a clinical experience and there's an evidence-based medicine. So we say that this is context-based medicine. Okay, so basically we know evidence base is important, but what if we don't have enough evidence yet? Not enough good quality data yet. Even some of the classifications itself have not been very helpful till now, to be honest, and forget about creating good understanding after collecting data based on them. So it is very important that experience is never underestimated. The context is basically something which is the combination of the number of experience, I call it the number of mistakes, and plus the evidence-based medicine. So for example, my very earnest colleague Erton Zeridogan and along with very bright Joe Kirsten, they have devised this classification. I would request you all, whenever you get a chance, to go through this classification. It's called NZN classification of endometriosis. They have simplified it. They have standardized it better, I think, and they have created exact codes so that we can pass on the information and reproduce exactly what we are saying, which site, location, which type of lesion, the extent, all of that is graded in a much more reproducible, standardized way to be able to gather the data in more useful way. And in this classification, I want to highlight that I think the DIE has been highlighted like never before, because that was kind of not classified very well in the previous classification. So that bit has been looked after very well. And overall, I would say it is more simpler and reproducible. Now, to use this classification, they have created a fantastic open source database. Now, anybody can download. This is not a girl. This is an open source database called Glenda. So Glenda stands for Gynecological Laparoscopy Endometriosis Dataset. This is freely available. There's no cost. You can easily download this and start collating your data on this. It's a global open source platform. So you use the NCN classification, and then you upload the data in Glenda. And that is how, in the next few years, hopefully, we should not call endometriosis an enigmatic disease. Briefly talking about particularly how AI has evolved, it started with the rule-based algorithms, and then it became like a medical image analysis and computer-aided diagnostics, and then like image analysis and predictive modeling. And then current applications still are majorly not in gynecology, but in radiology, dermatology, oncology, and gastroenterology. And the limitations that we still have to look into are the ethical, regulatory, and technical. And the early milestones of how this is going to play a big role is already emerging. How you will see the surgeries happen in near future is exactly like this. So when you'll be focusing the camera while doing a laparoscopy, the AI generated after collation of all the data on a platform like Glenda, they have actually identified 68 exact lesions, and the machine learning has helped the platform learn and analyze the data. So as soon as you focus the camera properly on the various locations in the pelvis, the AI will automatically identify the type of lesion so that we don't give different names to the same lesion. So one lesion is identified with one name throughout the world, and it is diagnosed with a particular set of characteristics, which the AI will automatically hint. Obviously, we have to check how accurate is it, but what I understand is it is pretty accurate so far. And it will tell you the lesions, and then it will help you map the pelvis accordingly, and hence make the decisions accordingly later on. See, when we see about the future in reproductive medicine, I'm just touching this point because it is really important to highlight how the novel therapeutics will work. Despite public assumptions about general AI, including REI, currently it only uses a narrow spectrum of AI. Looking ahead, the generative AI-powered systems will enable advanced human-like interactions with patients. That is the game-changing part, facilitating continuous and high-fidelity data acquisition. This persistent and context-aware engagement will enhance the precision of the predictive modeling, allowing for more accurate forecasts of patient trajectories and the potential clinical outcomes. Now, the avenues where we can see the outcomes can be enhanced are diagnostic, the data analysis, minimal bias in the studies, enhanced quality control of the practices, accessibility to the care, mainly a country like India, very applicable, ongoing knowledge integration and learning, and scalable solutions for the widespread practice, and then cross-referencing in terms of when we hold the multidisciplinary team meetings through cross departments. Now, when we talk about transforming fertility treatments in specifically endometriosis patients, we can see that we start by seeing that there are difficult decisions because they are poor responders. We have many questions we have to deal with. It detects the early subtle signs of DIE. It identifies the lesions and sometimes even those which are missed by the conventional imaging, and improves the early detection, first of all. And for this, the platforms currently very actively being used. Glenda, I've already spoken. I will speak about very interesting European Union research-funded treatment called Female Project in my coming slides. And predictive modeling is the next part of this, which is for personalized planning. Like for a particular case, the age, AMH, the stage of the disease progression, surgical history, ovarian reserve. Now, these will help us address the important questions during the consultations, which is, should IVF be started early in this case? Is repeat surgery beneficial in this case? Or can we expect the spontaneous conception in this case? So reproductive planning optimization is by the pattern recognition. So it pinpoints the ovarian endometriomas and subtle fertility threatening changes and supports the timely fertility preservation related decision making, which is egg freezing for these patients or not, or early IVF for these patients or not. Just imagine, without this background of clarity and explanation, if we offer, it can be medico-legally challenged, but when we have a substantive, objective ground to apply this, then we can say, okay, there is a reasonable background based on which the patient is being offered egg freezing or early IVF. Similarly, these patients also would need AI in the embryo selection. There are platforms like ISWHR. Violet is being very widely used in UK. I know Bloom IVF is already happily using that. And enhancing the endometrial receptivity assessments. I wouldn't want to speak too much on that. AI-based decision support tools. So the next step in the guidance, which is whether this patient should try naturally now, whether this patient should do IUI or IVF, or should we do a repeat laparoscopy. So all this trial and error which we otherwise do, and all the emotional, financial burden which otherwise comes, is more justified when we make decisions for the patients, and the platforms that are going to really help us a lot, and we may get very addicted to the kind of evidence and help and objective data that they will give us in the coming years are Glenda, Violet, AIVF, and Female Project. So I would want to at least share the introduction with you so that you can go through them and maybe start introducing to your practice. From diagnosis to the embryo transfer, AI is going to empower clinicians to personalize and optimize fertility care in endometriosis with earlier decisions, better outcomes, and less guesswork. This is very crucial. Now, a few papers which I want to highlight to you. If you have time, you can go back and have a look at these papers. This one is basically the utilization of PGTA via AI is correlated with the single thawed euploid embryo transfer. So basically, this significantly increases the euploidy classification rates and the live birth rates, and decreases just the biochemical pregnancy rate when compared to the NGS. So this is very interesting. I love how they have framed the impact statement. So basically, it's the AI-based pre-implantation genetic screening tool. And what we know is that for the deselection of the at-risk and aneuploid embryos to prevent the unnecessary PGTA biopsy and the transfer, that is how I don't think there's anything else we can use to do such a thing. So when it comes to the rectosigmoid deep endometriosis, I wish I had more time because this paper needs a long time. I want to introduce this to you, how they have devised this methodology of this framework, how they have done the neural network model to use the suspicion of the rectosigmoid endometriosis. I cannot completely explain in this much time, and that is why I request you to go through this paper when you have time. But it is a very clever idea how this analysis is done by this particular neural network model, and this is how the algorithm is set after the data is fed. So this is how it is analyzed. I want to bring your attention to the next section, which is very interesting. The newer research projects, various departments, different interesting projects are based on single cell transcriptomics. It's a new black in the industry of pharmaceuticals. I'm sure anybody attached with the R&D of the pharma companies are already aware of this terminology, and they love it because it's a game-changing thing for them, and very promising, and probably is going to enhance their profits by multiple margins. So when we speak about diseases like endometriosis, these lesions are made of different populations, different small subset of populations of cells. Some are immune cells, some are endometrial cells, some are epithelial cells, and these cells may behave very differently, and they contribute disease in distinct ways. So it reveals the cellular heterogeneity in lesions, identifies disease-contributing cell populations, and novel insights for biomarker and drug target delivery. Now, think of a lesion as a mixed crowd of people all talking at once. The single cell transcriptomics is actually something which lets you listen to each person individually, so you can find out who's shouting, who's whispering, and who is the troublemaker. So this is where we can develop proper drug therapies. We know there is no clear nail on the head kind of a drug for endometriosis in the terms of medical therapy yet. And I think that is where this is going to increase our understanding how to develop medical management of endometriosis. When we look into this, how it works, there are various integrative personal omics profiling, genome, antibiome, epigenome, microbiome, metabolome, or proteome, and all taken together, these advancements represent a remarkable opportunity to harness computational power and AI across multiple scales, transforming how we analyze, predict, and engage with the complex systems. This is where I was waiting to come to. So I want to ask all of you to maybe take some time and go through this even on the internet. This is a very interesting, very cleverly designed project, which is called Female Project, and it's an acronym for Finding Endometriosis Using Machine Learning. It is a project which is funded by the European Union Research and Innovation Program, a platform that converts multi-dimensional population data sets into the personalized predictive model to improve the continuum of care of women with endometriosis. This is not open source yet, and it is started to be used in France. It is developed in France, and it is approved by Columbia IRB, but we'll be looking at the progress with very keen interest. I have stuck this in front of the space where I see patients, and I think it is very important to share that whenever we talk about novel things, we must make sure that anything new is fulfilling the criteria of the threshold of the principles of medicine: beneficence, justice and fairness, transparency, trust, autonomy, utility, acceptability, and patient-centered. This is very important. So ethics is one of the major barriers, I would say, so that we only go slow enough to make sure it is a safe style of progress. When we speak about the novel therapies involving genomics, in terms of endometriosis, these are the two simple ways to highlight how the progress is currently happening. So the deconstructing of the human endometrial cell states at the cellular level. So just like how I just mentioned single cell multiomics, even in my previous slide, this is making the principal technology base the foundation on which many of the R&D for the medical therapies are now being created. And the second one is, how do you store data? Modeling endometriosis in So basically, you copy that in the lab environment in the organoids. So you create endometriosis in the lesions in the lab, in the organoids, and then you study that. So these are where the applications of genomics are heavily changing and shaping the future of endometriosis understanding and then treatment. Future is super AI and the world with organoids. With so much tough data to be stored, there will be computer systems built using human brain organoids, cultivated from the stem cells, and this is signifying a bridge between the biological and artificial neural networks. I was very shocked to see this slide when I saw this first. So this is the tiny human brain tissue. It's called organoid, and this was taken from the Neuroscience News. So this is how we will be preserving the data in future, as opposed to heavy tech data centers that we see. This is another way to store huge amount of data in the organoids. Thank you very much. I hope I could do some level of justice to the time that you spared to listen to the presentation. And I wish you all of you very good luck in the journey. And please stay in touch and write any feedback, even good feedback, to this email, which is office@londonfertility.clinic. And I'm very grateful to the opportunity once again. And thank you, everybody.
Thank you, Dr. Anu. That was such a wonderful presentation. And as always, you've been so informative and always been out there putting your point out.
Thank you very much.